Assalamu alaikum, everyone. Welcome. My name is Manazza, and I'm the chair of Health Committee at ICOI, and I'll be your host tonight. And first of all, just some gentle reminders to please keep your microphone settings on mute and keep your cameras off to avoid any disruptions. And if you have any questions during the webinar, please hold on to it, and we will get to you at the end of the session. Let's talk about today's webinar now. Last March, right after the first lockdown, we did our very first event, Coronavirus Things We Should Know. At that time, there was a lot of uncertainty and misinformation about the infection. Where is it coming from? Who's getting affected? And how can we stay safe? So our specialists addressed a lot of concerns and educated us at that time. We moved on, hoping for a cure to arrive soon. And looks like a year later, it's here. But we are still in a partial lockdown, and there is a lot of uncertainty and misconceptions around this COVID-19 vaccine. People have started to take it, but there is still a lot of confusion. The number one question that we are getting from people is that how effective is this vaccine? How was it developed so fast? Did it go through enough trials and tests? And among many Muslims, the concerns are religious. Are there any religious restrictions for its use? With an overabundance of information circulating the internet, it's tough to decide what to believe and what not to believe. So today, our panelists are going to address all these questions and some more. Please welcome our panelists, Dr. Sahir Khan, who is an infectious disease specialist at USC, Dr. Alia Khan, who is a certified physician in occupational and internal medicine, Sheikh Atif Maghoob, our ICOI's Imam and Religious Director, and Farah Khan, the newly elected mayor of Irvine. Welcome, everyone, and thank you so much for your time today. So first, I would like to introduce our returning panelist from last year, who's always ready to share his knowledge and expertise to benefit the community, Dr. Sahir Khan. He's a medical doctor and a PhD from Northwestern University, Chicago. He's currently working as an assistant clinical professor of infectious diseases at University of Southern California. He has also written articles about coronavirus in OC Register. He sees patients with COVID-19 in the hospital and conducts research on COVID-19 treatments and immunity. He will give us an overview of infections and vaccines and the development of COVID-19 vaccine. Welcome, Dr. Sahir. It's great to have you back. Over to you.
All right. Assalamu alaikum, everyone. Thank you for having me back again to give you another update on the situation with COVID-19. And so I'm going to start with just a quick overview of COVID-19 situation in Orange County. You know, we had a holiday surge that now appears to be ending, at least plateauing, but our cases, our hospitalizations, and our deaths are still at a very high level. And this is just data. You can see the graphs of infections, deaths, and of our hospital cases. This is all from the Orange County Healthcare Agency. And so basically the key message here is that while it doesn't seem like our cases are going up exponentially the way they were a few weeks ago, our healthcare system is still at capacity. And so we're still in a very tenuous situation. So I'm going to switch gears a little bit now, talk about the vaccine. So I was asked to give a little bit of a history of vaccinations. And, you know, in the last 100 years or so, vaccines, and actually going back even before that, vaccines have been responsible for elimination of many diseases that were, you know, causing a lot of morbidity and mortality in the human population prior to the vaccines. And these include smallpox, which has been eradicated, polio, which is sort of near eradication, still present in some countries, measles, mumps, and rubella, which again have been largely eliminated from countries where the vaccine has been widely administered. We still see some measles outbreaks from time to time because certain communities have low vaccine uptake. And diphtheria is another one we don't really see in countries where the vaccine has been widely implemented. And in addition, vaccines have significantly reduced the burden of many common diseases. So influenza, you know, since we've had vaccines for influenza, the rate of mortality from influenza has gone down, because even if people still get the flu after vaccine, in some cases, it tends to not be nearly as severe. Same with pneumonia, particular type of pneumonia caused by a bacteria. Um, that has gone down with vaccines. Types of meningitis that we have vaccines for have been decreased significantly. Hepatitis has been significantly decreased by hepatitis B vaccine. And then chickenpox, there's a vaccine now. And so, it used to be every kid gets chickenpox, but now most don't, and most get the vaccine and are protected. So I'm going to talk a little bit about a particular new technology that is part of a couple of the vaccines for COVID that have been the first to be approved by the FDA. And these are the Pfizer and Moderna vaccines. They're RNA vaccines. And there's been a lot of misinformation out there about what RNA vaccines are and what they do. Basically, RNA is a blueprint for your body to produce proteins. And so in this case, we inject RNA and it gets inside your body's cells, and it tells those cells to start producing proteins that are actually from the virus. And then your body develops an immune response to those proteins. And that generates antibodies that protect you from infection. And RNA is short-lived, doesn't remain in your body for more than a few days. RNA vaccines do not alter your DNA. It's a different type of a nucleic acid. The RNA does not change your DNA. Studies show that RNA vaccines have good efficacy and safety compared to the more traditional vaccine technologies. This was relatively new tech. Well, the technology's been around, but it hasn't been successfully implemented before. So this is really the first time we've had this technology widely implemented for vaccines that have been approved and are being used. But we've done numerous studies of these vaccines, and they appear to perform well, both in terms of effectiveness and in terms of safety, compared to vaccines made by traditional technologies. The advantage of these RNA vaccines is that it's something that's very easy to change. All you have to do is change the sequence that you put into the vaccine, and you can essentially, they're called sort of plug and play vaccines. Like you can quickly update it to reflect changes in the virus, mutations in the virus. And that's something I'll talk about in a little bit. The disadvantage of RNA vaccines is this, you may have heard of this cold storage. So they have to be stored at very cold temperatures because RNA itself tends to not be as stable. So it has to really be stored in cold temperatures, and that's made the distribution challenging. So COVID vaccines in the US, there are essentially two that are approved already or have undergone emergency use authorization by the FDA. And these are Pfizer's vaccine and Moderna's vaccines. They're both around 95% efficacious or effective. And both of them are 2-dose vaccines. For Pfizer, 3 weeks apart. For Moderna, it's 4 weeks apart. So the 3 other vaccines that are sort of in the pipeline where they've published the data and just waiting on the FDA to approve them, there's AstraZeneca and the Johnson & Johnson vaccine. So AstraZeneca, these both use what's called a viral vector. So basically, it's a different type of virus that doesn't cause disease in humans. It's called an adenovirus. And they've essentially included a gene from the coronavirus in this other virus. And so the virus expresses one protein from the coronavirus, and then your body develops an immune response to that protein. And that's what protects you. And so AstraZeneca is a 2-dose series, and Johnson & Johnson is actually a 1-dose vaccine. And they recently have published their data. Both of these are a little bit less effective, that 70%, 72%. But just to put it in perspective, this is still better than the flu vaccine most years. So this is still pretty good, but it's not as good as the Pfizer and Moderna in terms of effectiveness. Johnson & Johnson had the advantage of being 1 dose. And then the Novavax is another company that produces a vaccine where they take the protein from the coronavirus. And this is a 2-dose vaccine about 3 weeks apart. And this is actually 89% effective in the studies, at least in locations where they haven't had widespread variants yet. So given the limited vaccine availability, it's unlikely that you'll have a choice of vaccine. So it's recommended that you get whichever vaccine is available to you first at the time that it becomes available to you. So yeah, we recommend, it's unlikely you'll have your choice of vaccine. So what are some of the side effects? there's side effects that can be due to injection, and these are fairly common. This is like arm pain, soreness at the injection site, usually limited to 24 hours. There's side effects that are due to the immune response, and this is also very common. You can have fevers, chills, muscle aches, usually limited to 24 hours again. And this doesn't mean that this actually means that the vaccine is working if you have some, because the point of the vaccine is to stimulate your body's immune system. And fevers, chills, muscle aches, these are all indicators that your body's immune system is stimulated. There are rare side effects, so allergy. So people can be allergic to anything basically, and so allergic reaction to the vaccine components can happen. Particularly, this polyethylene glycol that a lot of people are allergic to it, and there's some additives in these vaccines that are similar to polyethylene glycol. But again, these are fairly rare allergies that happen. So I'll talk about this in a little bit, but basically if you have had a severe allergic reaction to a prior vaccine, it's recommended that you get this vaccine in a monitored environment. You can still get the vaccine, but it's just recommended it's in a monitored environment. And then there's very rare side effects due to what's thought to be autoimmune reactions, where your body produces antibodies that attack itself. And these are even still somewhat theoretical, because in the trials, very few people had some temporary nerve disorder like Bell's palsy, or transverse myelitis is another one, which temporarily caused dysfunction of the nerves. And these do usually resolve spontaneously within a few weeks. But one thing, you do a study of tens of thousands of people, even in the placebo group, some small number of people are going to get these types of disorders, because sometimes they happen without a known cause. And so it's still unclear to what extent these are associated with the vaccine, but it should just be mentioned that the studies did show a very small number of cases of some of these types of reactions. And so who should get the vaccine? So it is recommended that nearly all individuals should get the COVID vaccine when it becomes available to them based on age, medical conditions, and occupation. And as the risk of getting COVID-19 far outweighs the risk from getting the vaccine. And there's really no strict category of people that I would say is like an absolute contraindication. There's groups of people in which the vaccine has not been studied yet. So in the trials, there were not pregnant women, or there were not people with compromised immune systems. But to me, there's not a scientific reason to believe the vaccine will be more risky in these people. It's not a live vaccine. So, it's, even though they weren't included in the trials, many doctors, myself included, are still recommending it after a discussion, of risks and benefits and everything to these groups of people. Another group is children under the age of 16. The vaccine has not been studied yet. So the FDA approval was for, I believe, age 16 for the Moderna vaccine, age 18 for the Pfizer. But, again, it wasn't studied in children, but that data will hopefully come soon. And we don't have any reason to believe it will be more risky. There are some situations where you should probably wait to receive the vaccine if you just had COVID-19, and particularly if you received one of these antibody-based treatments, like monoclonal antibodies against COVID-19. Those antibodies can stick around in your system for up to 90 days. And if you already have antibodies to COVID at the time you get the vaccine, you may not get as effective an immune response to the vaccine. And then again, as I mentioned, if you had a serious allergic reaction to another vaccine, you should receive the vaccine in a monitored environment. So you've probably heard, I was asked to talk a little bit about these variants. You've heard in the news that the virus is mutating, as viruses do. And so there are different variants of the virus, and these are generally named for the locations that they were found in. So UK variant is clearly more contagious. Still unclear if it's more deadly or not. There's no clear evidence on that. It's currently present in most states, including California. This one, there's no evidence that it confers any resistance to immunity from the vaccine. And there's a California variant that was recently discovered that is actually responsible for about a third of the cases in LA. This is also likely more contagious. There's no evidence it's more deadly, and this one doesn't confer resistance to immunity from the vaccines either. The two variants, South Africa and Brazil, are a little more concerning. These are likely more contagious, not more deadly, but these two variants do confer partial resistance to immunity from either the vaccine or prior infection or or from the antibody-based treatments, the monoclonal antibodies. And so in some of the trials of these vaccines, the effectiveness can drop from around, 95% to more like 60% for some, in these variants. Some of the vaccines were studied specifically in South Africa as compared to other regions. And we do see a drop in the effectiveness, maybe from around 95% for the best vaccines down to about 60%. And just to put it in perspective, that's still as good as the flu vaccine. And the more important point with that is that even the people who are getting COVID with these variants after getting the vaccine were not getting severe disease. So they weren't ending up in the hospital. So it appears that even if these variants are somewhat resistant to the vaccines to some extent, the vaccine still it seems to be able to prevent severe disease even from these variants. So things to just general points about the variants, it's likely that they're more common in the US than is currently known. So like the Brazil and South African variants were recently found in the US, but we are not doing very much surveillance. There's very few people who are actually getting their virus sequenced. So it's likely that they're more widespread here than is currently. It's similar to at the beginning of COVID, cases will pop up here and there, but we knew that for each case we found, because at the time we didn't have very much testing, there were likely hundreds of additional cases that we didn't find. So some of these variants reduce the efficacy of vaccines, but they're still as effective as flu vaccine and still prevent severe disease requiring hospitalization. So because the virus is mutating is not a reason not to get vaccinated. The current vaccines will eventually be updated to be more effective against these new strains. And that'll likely happen by the fall, because as I mentioned, at least for the RNA vaccines, it's not very difficult to update them. And in general, while the vaccines will not eliminate COVID-19 from the human population, I would think this virus is going to be with us in some form forever. Same way the flu virus is. The virus will keep mutating, but I think what the vaccines can prevent is they can prevent severe disease, and they can reduce the morbidity and mortality of COVID to the point where we hope that eventually, once the population as a whole has developed some level of immunity, that people might still be getting COVID because the virus mutates to overcome that immunity. But we hope that we won't see the severe hospitalizations and severe disease. And so we hope that the burden of disease will be something more comparable to seasonal flu eventually after the population is vaccinated. So that's what I had, and I'm happy to, I guess we're going to do questions at the end, I believe. So
yes, we will take the questions at the end. Thank you so much, Dr. Sahir. That was a very valuable information that you shared with us, about the new technology. Especially many of us have been taking vaccines for so long, and we are getting used to of the flu virus being around, that okay, we have the treatment, we will get cured and stuff, but it still has impacted a lot of people around the world. And now we have this coronavirus, and it's having even bigger impact. So it's good to learn about the new technology and how we can save lives with this. So thank you so much for sharing that. And
and I should just mention one other thing. I got the Pfizer vaccine myself, and I was very happy.
That was my next question. Yes, thank you for sharing.
I had like some mild chills just the night after the second dose, but I was fine. And so I had a good experience with that.
So you only had the first dose now?
I had both doses. So the first dose I had no issues, no side effects. The second dose I had some mild chills in the evening, but then they went away within a 24 hours.
Okay, that's what we are hearing, that the second dose people are getting a little bit of effects, but it's mostly they're getting over it.
Yep.
Thank you so much for sharing that, Dr. Sahir. We really appreciate it.
All
right, everyone. So our next panelist is Dr. Alia Khan. And Dr. Alia Khan is an occupational medicine residency program director and assistant clinical professor at University of California, Irvine School of Medicine, and program director in public health. She holds dual board certifications from the American Board of Internal Medicine and the American Board of Preventive Medicine. She also has master's degree in environmental technology from UCI. Dr. Khan's clinical work is at the Center of Occupational and Environmental Health that provides clinical and preventive services to local and regional employers. She also leads a podcast on worker and environmental health for the professional organization. She will educate us a little bit more about on the global impact of COVID-19, as well as discussing the safety protocols to follow before and after receiving the vaccine as well. So I think it will be very informational. Stay tuned. Thank you so much, Dr. Alia. Welcome, and over to you.
All right, Assalamu alaikum, and thank you for the introduction, and thank you for ICOI for having this webinar and for having me, and hopefully I can share some valuable information to you all. First, let me go up here. First of all, I have no disclosures. Unfortunately, I have no stock in Pfizer or Moderna. This is what I'll be talking about. I'm going to give a recap of what's been going on with the pandemic, give you some information more about the vaccine, what you can expect before, during, and after. And I want to get to know you guys a little bit more and find out if any of you have had the vaccine already. So the instructions are right there on the top. You can log on to pollev.com or text and let me know if you've already gotten the vaccine. And so I'll give you guys a moment to respond here.
Do you see any clap signs?
They should be, if you follow the instructions on the top, you can go online or text those instructions on the top. You can see that and put in your information, either yes or no. No, it's not popping up. That's all right. I'll just move on. Oh, got one there. All right. In the interest of time, I'll move to the next question if you guys want. I just wanted to know if you're thinking about getting the vaccine, but we can, if you're having trouble logging on, we'll move on to the next slide. All right, so here's a recap of what's been going on. This data is just from yesterday, and these numbers are really sobering here, especially this one, where you had more than 400,000 deaths just alone in the US. And these numbers are really an underestimate. We expect these numbers to be much higher because not everyone has had who's had COVID actually had a test to show that they actually had the disease. So you saw this slide earlier. This is from the Orange County Healthcare Agency. So we see this large surge here that we're kind of recovering from, but as you can compare it to this summertime, this is way more that we've had. So we're really in the thick of it still. Who is it affecting? You know, a lot of these cases are actually happening in the younger population here. So you can see that majority of the people that are getting infected are in the 25 to 34 age group. And unfortunately, we're seeing this disproportionate effect in the Hispanic and Latinx population. When it comes to death, we're seeing higher deaths in the older population, even though they don't make up most of the cases. And we're also seeing that disproportionate effect, again, in the Hispanic and Latinx population. So this is the prediction model for California specifically. As you can see here, this red line is if we don't do anything, if we don't ramp up our vaccines, if we're not good with masking, we can expect our daily deaths to go up that high. But if we can get at least 95% of the population in California to mask, we can really bring those numbers down. What about if we do ramp up the vaccines, then we can get it, bringing it down. How about daily infections and testing? Again, if we don't get those vaccines into arms and we don't have people masked, these numbers will go up much higher. And if we do get people to mask, we can bring those numbers down. Again, the vaccines will help. So it gives you an idea of what we can expect. Of course, these are just predictions. So in California, we've administered about almost 3 million shots, but really we have a long way to go. Only 1.2% of Californians are fully vaccinated. I do want to go over the symptoms of COVID-19. Just as a reminder, I have patients who tell me all the time, oh, I just have a bit of a cold. I have a little bit of runny nose, sore throat. This is what I get every year. But COVID-19 is a coronavirus, and there are other coronaviruses that cause the common cold. So you're going to see similar symptoms. So if you do have any of those symptoms, you want to isolate at home and get yourself tested. I've had people who just had a runny nose and test positive for COVID. And when we think about COVID-19 and compare it to, the death rate and all these things, we don't want to forget about the other effects that COVID-19 can have. And we're just, learning about the long-term possible effects. One of those being what's called long haulers, where some people are having a hard time recovering from the symptoms of COVID-19, which can just last months, where people have this immense fatigue and body aches and brain fog. And it can even happen in young, healthy, athletic people like this WNBA star who doesn't know if she can return back to basketball. So we've had studies that show there can be neurological issues, cognitive issues, psychiatric issues, heart issues, and those who are recovering from COVID-19. So this is not your average cold or even average flu. And I want to just emphasize again that in order for us to end this pandemic, deal with this pandemic, it's a multi-pronged effort, right? It's great to get the vaccine, but in the meantime, we need to still follow all the public safety precautions, like wearing our mask, right? And in the beginning, there was a little bit of confusion back and forth. Should we mask? Should we not mask? We know for a long time now that masks do work because COVID is spread from droplets, and the mask can protect ourselves from getting infected by others and protect others from us. And it's really important for us to wear our mask properly. So don't be like Bill Clinton and show your nose. Be like my daughter over here who's showing you how to properly wear the mask. And it's important to always wash our hands before and after we touch the mask, and try to don't touch the front of the mask, but also try to just use the straps. Washing hands. So we got to wash our hands, because if the virus is on our hands and we touch our eyes or nose or our mouth, we can get infected. 20 seconds at least. It seems like a long time. And I tell my kids, if you don't see bubbles, you're not washing your hands properly. And physical distancing. I know this is one of the hardest parts of this pandemic, where we can't be close to those we want to be around. But really, we gotta just follow through with all these different protocols and precautions in order to end this pandemic. So avoiding crowds, poorly ventilated spaces, outdoors is always safer than indoors. And then, getting the COVID-19 vaccine is so exciting, this vaccine. Because we really didn't expect this vaccine to have such a high efficacy rate. I mean, it's literally a scientific miracle that we have here. And that we just don't have one vaccine that's so efficacious, but two. So Moderna is approved for anyone who's 18 and older, and Pfizer 16 and older. The previous physician talked about allergies, and I'll talk a little bit more about that in the next slide too. But generally speaking, if you've had allergies to food, medications, other vaccines, you can get the COVID-19 vaccine. And then pregnant women, nursing women, I get questions a lot about this. Is it safe? The trials did not specifically enroll pregnant women, though there was a small subset of women who became pregnant during the trials. And then the American College of Obstetrics and Gynecology do recommend the vaccine for all pregnant women. So we don't have an expectation that the vaccine would cause any harm to the unborn fetus or to a nursing child. For those who have a suppressed immune system, they can also get the vaccine. Really the concern for those people would be whether they would mount an appropriate immune response to the vaccine. And those who've had COVID-19, yes, you can get the vaccine after you've recovered. If you have active symptoms and you're in your isolation phase, you do not want to get the vaccine at that point. You don't want to go into a vaccine center and expose other people, or if you've been exposed and you want to finish up your quarantine before you go get the vaccine. CDC is recommending that you wait about 90 days after your COVID infection to get the vaccine, because we don't have an expectation that you would get reinfected that quickly. But you can, technically get it earlier too, if there's enough vaccines around. If you've gotten your first dose of the COVID-19 vaccine and you had a severe allergic reaction, we don't want you to get the second dose, and you want to just talk to your doctor about the next steps. If you had a severe allergic reaction to any of the ingredients of the vaccine, like the polyethylene glycol, again, you want to talk to your doctor about whether it would be safe for you to get the vaccine. At the end of my slides, I do have a list of resources, and there's documents that show the ingredients in the vaccine, so you can take a look at that. And again, if you've already had the monoclonal antibodies, which is used to treat COVID-19, which is what President Trump had, you want to delay your vaccine if you've gotten it within 3 months. Who's eligible to get the vaccine? These are the different populations. I believe the mayor will be talking more about the tiers, so I'm not going to go into detail about that. So once you've decided you're going to get the vaccine, you want to see if you're eligible, schedule your appointment. Once you get your appointment, you want to avoid Tylenol and ibuprofen, those kinds of medications before your vaccine, because they could potentially reduce your immune response to the vaccine. And then obviously, when you're going to the vaccination site, make sure to wear your mask. So I got the Pfizer vaccine, that's me right there. And I tell you, I was so excited. And after my first dose, I just had some mild arm pain at the injection site. The next day I actually went skiing, so I felt pretty good. After the second dose, I had a little bit more of moderate pain. I had a little bit of chills and a little bit of a headache. Nothing that stopped me from doing what I needed to do. I actually didn't take any medications, but if you do end up with some side effects, you don't feel good, you can at that point take some Tylenol or ibuprofen if you want. And then the next morning I woke up and I felt perfectly fine. So these are some of the symptoms or side effects, I should say, that people get after the vaccine. And I put there that it's actually a good thing or good sign that you've gotten some side effects. It means that your immune system is responding. We've actually seen that people who are 55 and older actually tend to get less side effects than those who are younger. So if any of you are in that age group, or you have parents or grandparents who are concerned about side effects, you can reassure them with that. I do want to let you know about this app from CDC. It's called Vsafe. After you get your vaccine, you can sign up and you'll get text reminders and questions about how you're feeling after your vaccine. And they're keeping track and what kind of side effects people are having. They'll actually remind you for your second dose. I really encourage you to sign up for that. And don't forget to schedule your second shot. With the Pfizer and Moderna, they're 2-dose series, and really going to get the full potential efficacy if you get both doses. This is data from that Vsafe app. There are other safety reporting mechanisms for vaccines, but this is really nice. They got the data right from about 2 million doses. So you can see about how many or how frequent the side effects are. So pain tends to be the most common, and then it goes down from there. With allergies, I had mentioned earlier, they're pretty rare. And when you're at the vaccination site, you will be observed for 15 minutes at least. Most allergic reactions, if you're going to have it, will happen before the 15-minute mark. But if you do have a history of allergies, you do want to tell the vaccination site. They're going to be asking you a series of questions, and they may ask you to stay a little bit longer, like 30 minutes, just to observe you just in case. So it's very safe. So this is what to expect. So the fact that you're here in this webinar and you're learning more about vaccines is great. Once you get your vaccine, you'll get a nice little vaccination record card. So a souvenir, you can probably take it and maybe get you into concerts, I don't know. And then afterwards, you're going to expect maybe some side effects. So you may want to take it easy the next day and enroll in the Vsafe app. So now what? Can we get out of our bubbles? Can we go and hug our friends? Not just yet. We want to hold up here. We still want to maintain all the same safety precautions, wearing our mask, maintaining the distance and everything. Why? Because the vaccine is not 100% effective. And as we've just learned, there are these variants too. So it's just too early for us to stop doing everything that we've been doing just yet. And also, a lot of us have not been vaccinated yet. So there's still a lot of COVID that's circulating. So we want to still maintain that for now, but we don't expect to stay like this forever. So these are my take-home points. COVID-19 is still very much rampant here in Southern California. It's likely not to go away, possibly seasonal. We're probably going to need booster shots. But we do know that the vaccine is highly effective. It's safe. And in the meantime, let's continue still following all the same safety precautions of physical distancing, wearing our face mask until we are told otherwise. All right, and that's essentially it for my presentation. Thank you so much, and I'll take questions later.
Thank you so much, Dr. Alia. That was very insightful, and it's very eye-opening to see that how this virus has impacted our lifestyle so far. So, and now we have this cure. And I like what you said that it's not a regular cold or virus. So it's very important that we keep following the safety protocol, and that's the only way that we can together help reduce the impact of this virus. So thank you so much for reminding us that. All right, everyone. So our next panelist is a very influential personality who is highly respected by the entire Irvine community, a man that needs no introduction, but I'll try my best. Respected Sheikh Atif Magoo. He's a religious director at the Islamic Center of Irvine. Sheikh Atif was classically trained at Al-Azhar University school system since he was 8 years old. There, he received his advanced degree in Islamic studies in 2002. At ICOI, he oversees all religious and educational programs and activities regularly and during Ramadan. At present, he's conducting these programs virtually. And in addition to leading prayers, he teaches educational classes for youth and adults, provides marriage and funeral services, and various forms of guidance for community members. In fact, prior to the pandemic, he also used to go to prison to see inmates. He also published scholarly articles and books. And just 2 years ago, he wrote an entire Quran summary for Ramadan. He's truly a role model for our Muslim community in Irvine, especially the Muslim youth. Sheikh Atif will discuss Islamic perspective on illness and self-care, and what does our belief say about taking care of yourself generally. Welcome, Sheikh Atif. Please take over.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullah khair for this beautiful introduction. And I would like to start by thanking you, Sister Munaz, for organizing this event, for the time and the effort that you put in there. And also say thanks, Dr. Alia and Dr. Sahir for their time as well and for their expertise. May Allah subhanahu wa ta'ala bless them. And also, once again, would love to congratulate our newly elected mayor, Sister Farah. May Allah subhanahu wa ta'ala bless her and bless her family and facilitate her affairs. Allahumma ameen. First of all, pandemics are trials. They are great tests from Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala, reminded us in the Quran in different locations that during the time of trials, during the time of hardship, the best thing to do is to, do everything possible to revive our relationship with Allah subhanahu wa ta'ala, to humble ourselves before Him, to ask Him forgiveness, and to also reflect on how powerful and mighty He is, subhanahu wa ta'ala. With regard to taking measures, our religion is a religion that aims really to preserve the life of people. One of the goals or one of the purposes of Sharia is protecting the life of people. And so you find Allah subhanahu wa ta'ala in the Quran also tells people, وَلَا تَقْتُلُوا أَنفُسَكُمْ, don't harm yourself. And the scholars took that to be, a general rule that you have to take care of yourself physically and spiritually and mentally and in every aspect of your life. With regard to taking measures such as quarantine and seeking medical treatment, this is really indicated by the teachings and the practice of our Prophet Muhammad sallallahu alaihi wasallam. You'll find so many strong reports in the Hadith literature that Rasulullah sallallahu alaihi wasallam instructed us to seek medical treatment. And he also highlighted the importance of taking precautions against infections. So there's that famous hadith that he said, sallallahu alaihi wasallam, seek medical treatment. فَإِنَّ اللَّهَ لَمْ يَخْلُقُ دَاءً إِلَّا وَخَلَقَ لَهُ دَوَاءً. uh, seek medical treatment for Allah subhanahu wa ta'ala. Allah, may he be glorified and exalted, has not created any disease, but he has also created the remedy for it. And then he said, except for one disease, and that is old age. He said, sallallahu alayhi wasallam, in terms of quarantine, and he said, no sick camel should be put with a healthy one. And he also said, sallallahu alaihi wasallam, if you hear of a plague or if an infection in some land, so don't enter it, and if it occurs in a land where you are, don't leave it. And you see this hadith, we have been seeing this hadith, for the last year on social media, quoted by Muslims and non-Muslims alike. This is really what Rasulullah sallallahu alaihi wasallam predicted, or that's his really guidelines, during times of infections and pandemics. So the Prophet sallallahu alaihi wasallam was ahead of everybody, subhanAllah. With regard to the COVID-19 vaccine, and this is really an extremely important matter. We know that the pandemic has, as Sister Dr. Alia said, it has so far affected so many people worldwide and caused so many deaths of people as well. And the health officials, they told us that there is no way to stop this pandemic except by reaching the herd immunity. And they told us also that, it requires around like 70% of people to have immunity, and that could be achieved through two ways: allowing the infection to spread among all people, without reducing it. That's one way. And the other is vaccinating people against the virus. The first way doesn't go well with the Sharia, doesn't really conform with the Sharia and the teachings of Islam, because it risks the lives of people, especially elderly and the weak, which is in conflict really with the intent of Allah subhanahu wa ta'ala with regard to preserving all human lives, and the harm actually go beyond the realm of public health to affect people's worship, it affects people's livelihood, and other aspects also of their life. The second way is through vaccination, that's very harmonious with our religion and also with reasoning. The permissibility of taking medicine to fight an existing disease or prevent, an expected one is really a matter of ijma', consensus among all scholars, among all people of knowledge. The point of contention is whether it is, obligatory or not. So you see, in the last few months, you see various fiqh councils all over the world have addressed this matter in detail. And one of the cases where taking the medicine is mandatory or is obligatory is when the disease may harm others, and that definitely, or may apply to the case of COVID-19, which is extremely contagious. There are also, sometimes people ask about, what if the medicine that I'm taking has something that is considered to be, impure, considered to be haram in our religion to consume. Like, I personally get a lot of questions sometimes about gelatin. I don't know if any of the vaccines have any substance that are considered to be haram for us as Muslims to consume. I don't know, so you will have to ask your doctor about that. But usually the question that I usually get is about gelatin, whether in food or in medicine, And this is really a controversial matter among scholars. In the past, it used to be clear that everything that comes from pigs are considered haram for human consumption. And therefore, gelatin was haram to consume, according to the vast majority of jurists and scholars. Now, with science kind of shedding more light on the topic, we learned recently that the ruling on consuming it actually depends on whether the gelatin was transformed after being introduced into the manufacture process of food or medicine. if the treatment of the gelatin has turned it into another substance that differs from the impure substance from which it was extracted, then there's nothing wrong with eating it or using it. And the researchers actually, they said they found that gelatin that comes from, cattle or and pigs has already undergone a complete transformation, and it's completely different from the original substance. And this opinion actually was shared by so many Muslim scientists and scholars, and which led also the jurists and the fiqh scholars to change their opinion about the matter and leave it up to people, leave it up to consumer. So, but again, I'm not a doctor, so I really don't know if any of these vaccine contain anything that we are not allowed to take. But again, it is our religion is a religion that preserves the life of people. One of the aims of Sharia, one of the aims of the teachings of Islam is to protect people's lives. And when it comes to something like that, even if it contains something that we consider to be haram for consumption, in this case, this is a matter of life and death. In this case, you'll find so many opinions that will tell you to just, be on a safer side, take the vaccine, and Allah subhanahu wa ta'ala also knows your sacrifices. May Allah subhanahu wa ta'ala keep us all safe and healthy. May Allah subhanahu wa ta'ala protect us all from any diseases and from any infections. Allahumma ameen. Jazakumullah khair.
Thank you so much, Sheikh Hatif, Jazakallah, for sharing your knowledge with us. It's so relieving to know how much a religion emphasizes on personal well-being and, not to make things hard on yourself. And I really like what you said, that a religion focuses on preserving lives. I mean, that's really like, it's giving me goosebumps. And alhamdulillah, we have the cure, so we should make the best of it. Thank you so much for bringing this awareness to us. I really appreciate it. So, our last, but never the least panelist is a very inspiring woman, the Mayor of Irvine, Farah Khan. Mayor Farah Khan was elected as Mayor of Irvine in 2020, after serving on the City Council for 2 years. She's the first female Muslim mayor of a major US city, Irvine, a record she broke after becoming the first Muslim, Pakistani American, and women of color elected to the Irvine City Council in 2018. Serving the community is a lifelong passion of hers. Prior to being elected, she served as a regulatory affairs manager at a biotech company, executive director of the Newport Mesa Irvine Interfaith Council, PTA president and board member, and Irvine Community Services Commissioner. Mayor Khan is a champion for transparency and civility in government, promoting the safety and well-being of all Irvine residents, environmental sustainability, and social and economic justice. Mayor Khan, I cannot express how proud I feel right now to introduce you. Being a Pakistani Muslim American myself, it's really a proud moment for all of us. And I'm also proud of our Irvine community as well for, selecting you as our mayor. So welcome, please take over.
Thank you so much. It's such an honor to be here. I thank the Islamic Center of Irvine, and especially our two doctors, Dr. Sayer and Dr. Alia Khan. Alia Khan, we've exchanged, messages on social media, and I love how she's always out there inspiring people to do the right thing. For me, I think what I want to share with all of you is the importance of vaccines and how they're being distributed. Because I get a lot of questions about how are these vaccines being distributed, who's in charge, why aren't we doing enough? So I just want to kind of go over a little bit about that. And it all starts with the federal government that is basically purchasing the vaccines from right now the only 2 manufacturers that are making the vaccine. And so from there, it comes down to the states, and from the states in California then distributes the vaccine to the 58 counties and also 9 multi-county entities. Those are hospitals and other clinics that are in multiple counties like Kaiser Permanente. And right now in the county, we're getting about 40,000 doses a week. And so you can imagine with a county of 3.2 million people, that's definitely not enough to get us going, but it's a start. And so I just want to make sure that everyone understands that, it's been about a month since we've been administering the vaccine, and we are hoping to ramp up. Definitely now with the new administration on the federal level, we're hoping that they will be purchasing more vaccines and sending them down the pipeline. And once we get them down to our local level, our goal is to get at least 100,000 doses a week to cover as many people as we have in our county. And, within the county itself, we have two super pods, point of distributions for the vaccines. One is in Anaheim on a Disney site. The other is in Aliso Viejo at Soka University. The county hopes to eventually have 5 super sites open. And right now, with Irvine, we've already met with the county. We've, submitted 2 sites that we think will be good. They like both of the sites. But at the end of the day, they have a criteria system that they're following. And that has a lot to do with what the state requirements are of meeting not only the goal of vaccinating as many people as possible, but also the equity component. And that means making sure the vaccines are getting to those people that are in those high COVID case count areas, making sure that they're getting to those low income areas as well. And so there's a lot of work being done in Anaheim and Santa Ana that is focusing there before they get back to Irvine. And I hear it on a daily basis from people that are asking, when are we going to get a super site in Irvine? And why is there a delay? Well, the delay is just this, that we don't have the number of vaccines to open all the sites at one time. And as well, the county, as it's progressing, needs to meet certain components that are requirements by the state before it can start administering here in Irvine. And so I just want to make sure that everyone kind of gets the idea of what's going on there. And I know that there's a little bit of talk about the tier system that we're in. We're still in tier 1A. This is your majority healthcare workers. You've got skilled nursing facilities here. You've got your EMTs, your dentists, and also added into this tier were not only the firefighters, but the police department personnel that are in high risk situations where they're constantly dealing with the public, not those that are in desk jobs or in the office. And at the same time, the seniors, the age limit was reduced from 75 to 65 here in the county. And so right now we've got the county doing its thing. It's also got some mobile senior sites that are being opened up right now. Again, the 2 areas that we're seeing those open up in are Anaheim and Santa Ana. We have submitted the Lakeview Senior Center as a senior site. And as soon as we find out that's coming up for a contract, we'll let you know. But everything on our end has been done. I mean, the sites have been selected. We've submitted them. They've been approved. Now it's just a waiting game of when we get enough vaccines to open these sites up and start helping our community members here locally. But besides that, I think it's really important for us to make sure that while we are waiting for these vaccines to come, that we do everything we can to contain the virus, right? And that means keeping our numbers low. After quite some time, we're finally seeing those numbers go down, not only in case count, but also in hospitalizations and the ICU. And why that's important, not only for our health and safety, but it's important because the more those numbers go down when it comes to hospitalizations, then those hospitals will be able to focus their efforts on vaccine administration. And so, as they get their vaccines, right now they're focusing on their healthcare workers and everyone else. I know a couple areas, UCI and Hoag, are going to start or have started vaccinating the senior population, but we need more to add on. I mean, we've got Memorial Care here, we've got Kaiser here. So as soon as those hospital numbers go down and those vaccination numbers go up, we'll see a lot more activity when it comes to people being able to make those appointments more faster. Right now, I think the options that people have are the Othina app. It's othina.com. You can go and register on that website or download the app and register. You're going to answer a series of questions and then you're going to wait, because right now we have a little over 500,000 people that are registered on that app, and we're doing about maybe 35 to 40,000 vaccines a week. So it's going to take a little while before you get that email saying, go ahead and, pick your appointment date. And then all I ask is for your patience. People are starting to get those emails now, but it is a slow process. Again, until we get more vaccines, it's going to be this way. And so we just ask for your patience while we get to a place when we're able to get 100,000 doses and then get those into people's arms. And let's see what else I wanted to cover. Gosh, I think I've got most of it covered. I do want to make sure that you guys are aware that we do have an initiative in Irvine. I'd love for everyone to join in on. And if you go to the city's website, it's cityofirvine.org/Irvine Cares. It's really taking a pledge to make sure that you're going to do everything you can to protect yourself and the community as we wait for the vaccines to come in. We're getting people excited about doing this because, again, like was mentioned before by both of our doctors, is the virus doesn't go away just because we have the vaccine. That's not a cure. So we want to make sure that we continue, taking those safety measures and protecting everyone, and just making sure that in the long-term goal is to get it down to a percentage where it's not going to be a pandemic anymore. And so that includes us doing what we can right now, getting our case numbers down, and then getting those vaccines in people's arms. And other than that, I think I'll answer questions if people have them during the Q&A session. But just wanted to give you a little bit on case counts, just so you're aware. Just last week, we're looking at over 100 or 200 people being infected in Irvine. These past few days, it's been in the high 50s. But as a total cumulative, we've also lost 49 members of our community to COVID. And that's really important to understand. That's almost 50 people that are no longer here just due to this virus. And then when we look at the case numbers as well, we want to make sure that we understand that this is also including our youth from 0 to 18 years old. Cumulative, we've had over 1,000 cases in our youth. On a daily basis, we're seeing anywhere from 10 to 20. And so I know there are kids that are in school right now, and they're keeping their mask on while in school, but taking them off as they come out. We just want to make sure we're educating our kids as well to make sure that they're wearing that mask anytime that they're around their friends or in a gathering. And the same thing goes with vaccines. If you go to the Orange County Health Agency's website, there's a lot of data available for you to view. If you'd like it broken down, I try to put up weekly updates. And so you can go to any of my social media outposts and look that up. And at the same time, I sit on these weekly calls with the Orange County mayors, with our Orange County health officer, Dr. Clayton Chow. And so I provide those updates as well. So anything that's coming from the state or federal level, I try to put out as much information as I can, just so everyone is aware of what's going on and where we're headed. And again, I think I'll wrap it up there, but if anyone has questions, I'm happy to answer them.
Thank you so much, Mayor Farah, for sharing all that valuable updates with us. I'm sure that answered a lot of questions for people. Like, it's just so new for us, the entire vaccination system, that people are, trying to figure out, how to navigate the process. And so I'm pretty sure they got a lot of answers, question for them. We have asked people to submit the questions prior to this event. So I'm going to start with those, and then we will come to the live questions if we have enough time. So one of the questions that I got, Mir, for us, that for you, that should someone expect to pay for the vaccine or testing, or is it free for all? Because they ended up paying for testing $120 or something.
Yeah, the testing is not free. The testing usually the cost comes through your insurance if you have health insurance. And if you're going outside of your insurance, then you are paying for it. However, the vaccines are at no cost.
Okay, thank you so much. One of the questions we have is that, do you recommend the vaccine to middle-aged adult who already is infected with COVID-19? If so, what's the safest time to take it after recovery? Which one is better, Pfizer or Moderna? If one of the doctors can answer that.
So
Sure.
I guess sorry.
It's okay, go ahead.
So in terms of, you should wait. So at least until you're over the isolation period. The initial recommendation was to wait 90 days. That's more because your risk of reinfection in the first 90 days is not very high. So I think you're probably safe waiting up to 90 days, but at least for a couple of weeks until you recover from the active infection.
Okay. Thank you so much, Dr. Sahir. And then the other question is that, it is a bit concerning that the COVID will stay with us. What does that mean? Can you please elaborate a little bit more on that?
It means that, the virus mutates. So any vaccine we make, eventually the virus will mutate its way around it. Similar to, things like flu and common cold, there's no way to eliminate them completely from the human population. Another thing with COVID is there are animals, reservoirs of COVID. So, it can jump between humans and animals. And so that's another reason it won't be completely eliminated from the human population. However, I would point to influenza as sort of a similar. So in 1918, there was a pandemic and, very, very deadly, right? And that same strain of flu from the 1918 pandemic, versions of that same strain are still circulating today. But what happens over time is the human population builds up a level of immunity to where people can still get infected, but they don't develop as severe consequences. So the initial pandemic was very deadly, but then even though the virus is still circulating, it doesn't tend to have as severe consequences subsequently for the population. It becomes like the seasonal flu, essentially.
Yeah, and I'll just also add, like, if anyone remembers H1N1, and that was quite severe too, and now it's one of the most dominant strains of influenza. So one of the things that we want to emphasize is that these vaccines prevent severe disease. And that's really, the concern, that people are getting hospitalized, people are dying. And these vaccines, especially Pfizer and Moderna, are seeing virtually 100% effectiveness when it comes to severe disease.
Yeah, and sorry, in terms of the Pfizer, I think someone asked which one's better, Pfizer or Moderna. The data was very similar on the two of them. So I think whichever one's available.
Okay. And I think sometimes they're not even giving you the choice, whatever is like, you
just
cannot
take whatever you're
whatever
getting.
is there.
Yeah.
Right.
They're basically twin vaccines.
Right.
So
right.
we're really lucky that we have two really great vaccines out.
Okay, perfect. And this next question is for Mayor Khan. When do you expect that enough vaccines will come in so that people under 65 will start taking it as well?
It's hard to tell right now when people under 65 are going to start taking it, but we do expect more vaccines to come in anywhere from mid-February to early March. And that's really based on the federal orders that have been put out. We're hoping that that's enough time for us to get them down to our local level. And at the same time, hoping by the end of February is when the two other vaccines, fingers crossed, get authorized, and that'll add on to our dose levels as well.
Okay. Thank you so much. Dr. Farah? Let's see.
Not a doctor.
Oh, okay, I'm so sorry. Yeah, somebody wrote to me like live here, Dr. Mayor Farah. I'm so sorry about that. All right, let's see. I'm so sorry, everyone. We had a little glitch with the chat, so we're not able to see it right now as the questions are popping up. But you can try to hit the clap mark next to your name, and we'll try to open you if you want to ask live question. I'll just complete a couple of questions here. Just finish up those, and then we will take a few live questions as well. One question is that, if I already had the COVID virus, am I still contagious, and how long should I wait to meet people? So if Dr. Ali, if you can go ahead and answer that.
Yeah, so if you've been infected with COVID-19 and diagnosed, you are infectious, or you can spread the infection to others for up to at least 10 days. If you have improved your symptoms at the end of the 10 days and you haven't had any fevers for at least 24 hours off of fever reducing medications, and at least 10 days have passed, you're no longer considered infectious. If you've been hospitalized for COVID, then you may be infectious for longer, even up to 20 days at that point.
All right. Thank you so much, Dr. Alia.
So sorry, just to add one thing, there's a lot of confusion about this question because sometimes you can still have a positive test after that 10 days, but the current thought is that, the test can detect dead virus as well. So we really go by the time since symptoms. And so even if people's nasal test is still positive, we don't consider that person infectious once the time has passed.
Perfect. Thank you so much, Dr. Sari, for sharing that. There is a question about how to help. Is the OC Fire Department putting all the vaccine camps together for our country? And we want to help, and how and where we can volunteer. If Mayor, I don't know if you have the answer for that.
Sorry, the question was, are the firefighters doing all the vaccines?
Yeah, they heard that they're putting up camps together for the county. So
No.
people are asking if they can volunteer with them, and how can they help to, help with the eradication of the virus, or just to help reduce numbers.
So we do have a lot of our firefighters that are helping administer the vaccine. And in the very beginning, what they did was they set up 2 areas, or 3 areas, in Anaheim, Huntington Beach, and at the Irvine Fire Authority's headquarters, just to test out how the super pods would work. But those are not actively open anymore. They've all shifted to the super pods. But if people are interested in volunteering, they can go to oneoc.org to sign up. They're signing up people that can be vaccinators as well as those that can help out. But the caveat is that you have to be able to be available for 3 days in a row, because it is they use about 200 or so volunteers a day at each site. And so they do need commitment from folks. So if you are able to provide 3 days in a row, then I suggest you go to that website and sign up. And I'll put it in the chat as well.
Okay, that'll be perfect. So look for the website name, everyone. And it's like 3 days in a row. If you're available, you can go ahead and volunteer. And Mayor Farah will write it down for you in the chat. Also, someone is asking, can you spell the City of Irvine's app's name? Is that Athena that they're talking about?
I'll put it in the chat as well.
Okay, thank you so much. That would be perfect. And now let's see if we have anybody open for questions. So anybody interested in asking a live question, please hit a clap mark, and then we will open your microphone.
I had a question for the mayor if we're waiting for questions.
Sure.
I just wanted to know, in terms of people scheduling their second doses, what should they be aware of? So if they go to these super pod sites, do they get scheduled there at the site, or do they wait for some type of notification on the Athena app? How does that work?
Yeah, what will happen is the Athena app will automatically let them know when they're due for their second dose, and give them that opportunity to pick the timings, let them know where they're going. And the app itself will know which dose you got before, whether it was the Pfizer or the Moderna. So it'll accordingly send you to where those vaccines are available.
Thanks.
All right. And there is a question. I read that Pfizer's CEO saying that current vaccine will become ineffective against new strains, and they will be producing new vaccine to fight that. Does that mean we should wait for new vaccine to be ready, or we will have to take 2 different versions of the vaccine?
No, so I can answer that. I wouldn't say it will become ineffective. I would say as the virus mutates, the effectiveness will decrease from 95% maybe to around 60%. However, one, the strains circulating now, the vaccine is still very effective for, so you should get it now. Also, even if the effectiveness against those new strains drops to 60%, it still seems to be very effective in preventing severe disease from those new strains. So I would say get the vaccine now, and then when an updated version is available in the fall, get the updated booster shot then as well.
I would also add that it's still important to get the vaccine now too, because the more people that get vaccinated, the less, these mutations are going to be happening. There's so much COVID happening, and there's more opportunity for the mutations to happen. So again, I just want to echo same thing, get the vaccine whenever it's available to you.
Absolutely, absolutely. There is one more question, is that some clinics or sites are offering vaccine to everyone. So is it okay for under 16 to take the vaccine? They specify like for 14-year-olds and stuff. So if anybody.
Yeah, so the clinical trials for Pfizer and Moderna were tested. So Moderna is tested for 18 and older, and Pfizer is 16 and older. So the trials for children ages 12 to 17 are happening right now. They're enrolling children. So we don't have data yet to show the efficacy in children. So if there's a 14-year-old, they should not be being offered the vaccine unless they're in a trial and setting. That's different. But hopefully that should be happening soon. I have a 9-year-old who's eagerly waiting to get vaccinated, but he's got his ways to go.
Thank you so much, Dr. Alia. I think we have one live question. We will open that.
The important thing is the trials only looked at severe disease. So the trials didn't look at people who get, asymptomatic infection. So essentially, people who get the virus but don't get symptoms. And it didn't look at whether those people could transmit it to others. However, there is now starting to be some data out there. You can get virus after the vaccine, but it's reduced. So the vaccine appears to be around on the order of like 66% effective in preventing even the asymptomatic infections. Unknown at this point whether the vaccine reduces that transmission, but it is very likely that it does, because by reducing the number of people who get the vaccine in the first place, those people who do tend to have milder cases. So, and we know milder cases are less likely to be passed on to others.
I mentioned that, once we do get our vaccines, we still need to follow all the same safety precautions. So even if your entire family were to be vaccinated, we still want to maintain the physical distancing, not gathering, wearing a face mask. And I would emphasize that even more if you do have someone in your household that's unvaccinated. So like I mentioned, I have kids that are under the age of 12. So their trials are probably not going to be for a while. And so, I'm the only one in my household that's been vaccinated so far. So I'm still following all the same safety precautions we got to at this point for the reasons that were just stated prior. But, the good news, like we said, is the vaccine can help prevent severe disease, likely even milder diseases. There's still a 1 in 20 chance of getting infected, but that's a lot better than right now. We have no protection at all. And hopefully that answers your question.
One last question here is that for the mayor, when will the 2 sites be approved that you give proposal for? Do we have any update on that?
Don't have an update on it. Again, like I said, there's a lot of criteria that the county has to meet that they're trying to accommodate, and at the same time waiting for more vaccines. And as soon as those, a combination of those two fall into the right place, we'll be opening our sites. So it's a very fluid process. It changes on a daily basis. We thought the COVID pandemic was a little hard to follow, but even the vaccine administration is a little harder because things change on a daily basis of what's happening, where they're going. So as soon as we know that we've signed a contract, we'll make that public.
Thank you so much for answering that, Mayor. And I think we pretty much covered all the questions that we had coming in. If we missed, I apologize. The chat function was not working at my end, and our admins are texting so that, we can get to your questions and get it answered. But, give us your feedback on the Facebook, ICOI Facebook page. And, if you have any questions, just maybe refer to that, and we'll try to get it, just referring to this webinar, and we will try to get to you, hopefully. So everyone, I hope that this webinar was helpful to you in making informed decisions about the vaccine. And, you have a lot of local resources, so please use those. Mayor Farrakhan has, I think, posted in the chat a couple of websites for you. Please make a note of that. For Irvine, I highly recommend joining Mayor Farrakhan's Facebook page and Instagram page. She posts regularly and daily, and we get like a lot of updates, fresh updates from her posts. So once again, huge thanks to our panelists for taking out time and sharing your expertise with us. ICOI Health Committee truly appreciates it. And please stay for a few more minutes for a dua from Sheikh Atif. If he can please make a dua for all those that have left us due to this pandemic, those that are suffering, and for everyone's health. Please, Sheikh Atif.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وأصحابه ومن والاه الحمد لله. We ask Allah subhanahu wa ta'ala to ease the pain and the suffering of anybody who's going through any type of pain or suffering. We ask Allah subhanahu wa ta'ala to ease their pain and suffering. Allahumma ameen. We ask Allah subhanahu wa ta'ala to grant us all, well-being in our bodies. We ask Allah subhanahu wa ta'ala to grant us well-being in our hearing. We ask Allah subhanahu wa ta'ala to grant us well-being in our sight. Allahumma ameen. We ask Allah subhanahu wa ta'ala for well-being in this world and in the hereafter. We ask Allah subhanahu wa ta'ala for pardon and well-being in our religion, well-being in our worldly affairs, in our families, in our properties. We ask Allah subhanahu wa ta'ala to conceal our mistakes and keep us all safe. We ask Allah subhanahu wa ta'ala to guard us from in front of us and from behind us and from on our right and on our left and from above us. And we ask Allah subhanahu wa ta'ala, when we seek refuge in His magnificence, from being taken from beneath us. We ask Allah subhanahu wa ta'ala to remove the difficulty that anybody is going through. We ask Allah subhanahu wa ta'ala to heal everybody who's going through any type of illness. May Allah subhanahu wa ta'ala cure you. May Allah subhanahu wa ta'ala heal you. He is the only healer. No healing avails but Allah subhanahu wa ta'ala's healing. May Allah subhanahu wa ta'ala restore your health. May Allah subhanahu wa ta'ala restore your health. Allahumma ameen. And as for those who passed away, may Allah subhanahu wa ta'ala have mercy on your souls. May Allah subhanahu wa ta'ala bless your souls and join you with the prophets and the messengers and the truthful and those who follow their footsteps until the end of time. May Allah subhanahu wa ta'ala bless our scholars, bless our doctors, and bless all of you. May Allah subhanahu wa ta'ala keep you all safe and healthy, inshallah. Jazakumullah khair.
Thank you so much, Sheikh Atif, for the beautiful dua. Thank you so much again for everyone for joining us, and take care and stay safe. Assalamu alaikum.